Hi there, my name is Dr. Jeffrey Skinner, and today we're going to be talking about what sleep apnea does to your body and your health. In other words, how can sleep apnea kill you? I am a dual board certified dental sleep medicine provider here in Portland, Oregon, and I practice with a functional medicine and sleep specialist, Dr. Joe Zelk, and together we are some of the founders of the AIR Institute, which is a organization of doctors that figure out how to help patients look and feel younger. Although today we're going to be talking about poor sleep, we need to start talking about, just what good sleep actually is and what it does for you. So, rest, recharge, repeat. Here is the science behind sleep. It's essentially a superpower that helps us be the best that we can be. Good quality sleep can do a number of things for us. It can improve cellular repair and, in a sense, reverse aging. That's essentially what aging is just the breakdown of your body and your systems over time. And good quality sleep can, reverse the damage each night. It also can help with improving memory and your ability to think. It enhances your productivity and your performance in all areas of life. It can help balance hormones, it can stabilize emotions, and help improve your mood, and overall, it just helps you live a longer, happier, and overall better life. So, the main disease that we're going to be talking about with airway disorders is a thing called obstructive sleep apnea. This is something that affects about 20 to 30% of the population, and here's what happens, during one of these suffocation events common with obstructive sleep apnea. So the patient starts to relax and fall asleep, and during the day, all the fluid kind of collects in your ankles, so that tends to kind of rush back towards the head. So as that fluid comes back, the erectile tissue in your nose sometimes can puff up a little bit more because of that fluid pressure coming back, and that can block off some of the airflow through the nose. Then the muscles start to relax and start to paralyze as we go into deeper and deeper sleep. So during deep sleep and REM sleep, rapid eye movement sleep, that's the sleep where you're actually truly restoring yourself and healing. We're also paralyzed during that time. So, we don't end up rolling off the bed, or if we're fighting a big scary monster in our dream, we don't end up fighting our bed partner, things like that. So, as those muscles relax and paralyze, the airway resistance increases, and then that jaw can fall back and can close off that airway. The oxygen starts to desaturate, the oxygen in the blood starts to go down, and then that effort to breathe continues. You can see the patient in the video behind us start to kind of snort and try to gasp for air. You can see that effort happening. So the oxygen desaturates more and more, even though he's trying to breathe. And then that sympathetic nervous system engages. That fight or flight nervous system fires off, and you start to have an increase in your heart rate, and you also have other things going on as far as being knocked out of deep and REM sleep. And part of that is the adrenaline that squirts out, making that heart race. Also kicks you out of deep and REM sleep. So, or you can also awake to full awakeness, and then once you get knocked into deeper REM sleep, that airway reflex opens up that airway as you grind your teeth forward to open things up and get that tongue out of your throat. Then the patient starts to fall back asleep and the cycle begins again. So that's obstructive sleep apnea. The next one that we're going to be talking about is called upper airway resistance syndrome. And the best way to kind of think about that is with obstructive sleep apnea, we're talking about a issue where that airway totally shuts off. And then the next thing is where we are kind of breathing through a straw. That's what happens in upper airway resistance syndrome. So men are more likely to have obstructive sleep apnea. Women are more likely to have upper airway resistance syndrome, which involves that airway only partially being closed off. So you still have that same activation of the fight or flight, nervous system. There's more clenching and grinding with UARS. There's more jaw pain, The oxygen doesn't drop as far, but it's just as damaging as obstructive sleep apnea. And the current data out there says that 50% of the population or more is suffering from this. And it's also possible to have two at the same time. You can have obstructions, but also have, that kind of breathing through a straw thing. And that can be extremely damaging for a patient's health. So, as far as the health consequences of these airway disorders, they all stem from this fragmentation of sleep, as well as intermittent decreases in oxygen, increased CO2, and, these are the things that really account for all the problems experienced by patients with airway disorders. So all those things lead to systemic inflammation, as well as neurocognitive effects. You can't, think as clearly. There's cardiovascular effects, there's metabolic effects, there's endocrine or hormonal effects, there's effects to the mouth and your teeth. There's also increases in perception of pain and also premature aging. And as we go through the rest of the lecture, you also have to remember that obstructive sleep apnea is 80% undiagnosed, and upper airway resistance syndrome, even if you go to like a standard sleep clinic, a lot of those folks aren't fully diagnosing that because they're not staying up, on the current data. So these are going to be underrepresented in the percentages that we're going to be talking about later. And they, they create a lot of the problems that we see in our society today. And especially with premature aging, even the bed partner of somebody who snores gets an hour less of sleep each night. So there's like secondhand sleep apnea, just like how there's like secondhand smoke in the 90s. So even the bed partner of somebody who snores or has a sleep-related breathing disorder, they get about an hour less of deep and REM sleep each night. So the bed partner also ages prematurely unless things are fixed. So that premature aging comes from the lack of oxygen, lack of human growth hormone, and that fragmented and deep and regenerative sleep. When you lose that, you have increased inflammation, you've got oxidative stress, and that causes the cellular aging to accelerate. So when you don't get good oxygen, your entire body is making lactic acid, and that lactic acid leads to the clogging up of the mitochondria and makes them not function as well over time, and also can lead to a lot of the problems that we see as far as like neurocognitive decline and things like that. So, and once again, the bed partners of folks who snore or have a sleep-related breathing disorder are also affected by premature aging. So as far as the cardiovascular effects, the effects on the heart and cardiovascular system, we're talking about a huge increase in the risk for drug-resistant hypertension, because of all that sympathetic activation all night. Pulmonary hypertension, high blood pressure in the lungs, it increases your risk for arrhythmias and increases your risk of heart failure, as well as strokes and heart attacks, as well as changes of fat in your blood, a thing called hyperlipidemia, where your blood has more fat in it, and then also atherosclerosis. So we talk about sleep-related breathing disorders having these increased risk of cardiovascular effects, but snoring can also increase your risk of heart attacks and strokes, because just like how people can shake a house with their snoring, they also shake that carotid artery, and as that carotid artery shakes and vibrates, it is more likely to pick up the fat that's in the blood and the cholesterol, and that's kind of like putting a thumb on a garden hose. So it shoots up that pressure in the brain, as well as in order to overcome that blockage, there's pressure that goes backwards towards the heart too, and that increases the blood pressure of the coronary arteries of the heart and make them more likely to pop, which is the thing, a heart attack, a myocardial infarction. So anyways, the cardiovascular effects in sleep-related breathing disorders and snoring just can't be overstated. There's also problems with your metabolism. So when we have all that inflammation from having lactic acid floating around in the body all night, there's increased insulin resistance, and increased diagnoses of type 2 diabetes and metabolic syndrome. It throws off the fats in your blood. It increases your risk of obesity, as well as non-alcoholic fatty liver disease, which is also tied to cirrhosis, liver failure, and hepatocellular carcinoma. And as far as diabetes goes that sleep suffocation leads to inflammation, and that decreases the sensitivity of your cells to insulin. So studies say that decreasing the suffocations also decreases the A1C. So there's been a direct correlation between the number of hours per week that somebody's wearing a CPAP and how that decreases A1C. So that is a important bit of research that's out there for you to find. As far as obstructive sleep apnea and obesity, airway disorders can cause an increase in ghrelin, which is the hormone that is linked to appetite, and then can also increase your resistance to leptin, which is the thing that says that you're satiated, the hormone that says that you're full. So when you have sleep apnea, that can cause the obesity, which that obesity makes the sleep apnea worse, which makes the obesity worse because of your decreased metabolism and increased hunger. So it's just a vicious cycle that luckily with the new GLP-1 medications out there, we can help people get off that vicious cycle. So as far as the neurocognitive effects go, fragmented sleep patterns and increased sympathetic activation are associated with an increased risk of excessive daytime sleepiness, as well as neurocognitive impairment, the chance to think clearly. ADHD symptoms in children can also come out with poor sleep. There's also risk for memory problems because when you are in deep and REM sleep, that's when your brain processes short-term to long-term memory. It also increases your risk for depression, which about 24% of major depressive disorder is also linked to sleep apnea. It can increase your levels of frustration, and then also it can increase your risk for anxiety. So imagine if somebody walks into your bedroom during the night and starts choking you out, just like Bart and Homer Simpson. That would increase your fight or flight, and that would make you pretty anxious. So imagine if that was happening multiple times per hour, all night long, every single night. So that sympathetic nervous activation can carry on into the day and increase your risk of anxiety and some of these other problems. There's also a thing called the glymphatic drainage system, which is kind of the garbage chute for your brain, and that opens during deep and REM sleep, and that transports metabolic waste away. Things like amyloid beta and tau proteins that are associated with Alzheimer's when they get built up. And essentially, if you don't get good deep and REM sleep, that's like solid blocks, that channel doesn't have enough time to open up. So when we have obstructive sleep apnea, we don't get rid of all those harmful chemicals like amyloid beta and tau, and those build up, and that's where a lot of that neurocognitive impairment and Alzheimer's type problems come from. So that lack of deep and REM sleep means that memories can't really be processed and integrated by the hippocampus, and children experience higher test scores after palatal expander and or tonsil removal occurred. And children with sleep problems in the first 5 years of life have a 40 to 60% increase in their risk of special needs education, and children with airway problems can get symptom relief from treating their sleep apnea, but the neurocognitive deficits remain. Although they can get, kind of back on track, they can never truly heal from what's happened, which is a really sad thing. And one of the things that we're finding out is that between 25 and 57% of ADHD cases in kids is actually sleep apnea. Like, when you're at Disneyland or a fair or carnival or something, or even at the grocery store, and there's a kid, throwing a temper tantrum, and people say like, yeah, my kid's just tired. There's that paradoxical effect that happens when kids are really tired. They get, kind of hyperactive. And if they don't get good sleep during the night, they're going to be having that kind of stuff happen during the day quite frequently. And there's also a big connection between depression and airway disorders. Interruptions in sleep and oxygen from obstructive sleep apnea can lead to fatigue, decreased energy, difficulty concentrating, as well as changes in brain chemicals like serotonin, which is common in depression. So 1 in 5 patients with sleep apnea is also diagnosed with depression. There's also issues with relationships in folks that have airway disorders. Poor sleep increases your irritability and also decreases your sexual arousal. For every hour of sleep lost, that's associated with a 14% decrease in libido for women. And snoring is the third leading cause of divorce in America. And for men, having only 5 hours of sleep can lead to a 10 to 15% decrease in testosterone. And because of that sympathetic nervous stimulation, all night, that can decrease your ability to orgasm as well. And accidents are also a big problem for sleep and suffocation disorders. Over 100,000 deaths a year can be tied to drowsy driving. One person dies from drowsy driving every hour, according to the National Highway Transportation and Safety Administration. And there's also problems with cell signaling and systemic effects that happen because of sleep suffocation. So you get increased inflammation throughout the entire body, which decreases insulin sensitivity, and then also it can decrease the efficiency of your mitochondria to make energy. There's disruptions to leptin, which is that satiety hormone that tells you you're full. There's disruption to ghrelin, which is the hunger hormone. And then there's also issues with sex hormones like testosterone, progesterone, and estradiol. When you're not getting good sleep, you're also not producing human growth hormone out of your pituitary. You're changing your cortisol balance, which is the stress hormone. There's issues with aldosterone and antidiuretic hormone. So that's why folks with airway problems have to wake up so much to pee during the night. And then also that's part of the problem with a lot of bedwetting for kids is the sleep apnea component. There's decreased production of melatonin and also prolactin issues as well. So cell signaling and the signaling within your body gets all kinds of jumbled up. So it's kind of hard to have a good, healthy body when we're not having proper signaling and our body just kind of ends up getting into like a traffic jam and getting all kinds of dysregulated when we don't get good sleep. So as far as the systemic effects go, we're talking about those endocrine disruptions, inflammation, increased risk of other chronic diseases out there like congestive heart failure, high blood pressure, type 2 diabetes, polycystic ovarian syndrome, hormonal disorders, asthma, which is essentially just a small airway that when it gets irritated, it puffs up and gets even smaller. Osteoporosis is also tied in with sleep apnea because your blood gets acidified when we don't have good levels of oxygen in it, and then also that lactic acid floating around. Your body needs to buffer that acidic blood and takes that calcium out of the bones in order to do that buffering. You also have increased risk of cancer. Severe obstructive sleep apnea can be associated with a 15 to 30% increase in cancer compared to control. And folks that don't have sleep apnea. So the most common cancers that we see are kidney, melanoma, breast cancer, and uterine cancer. And that was a really large study with 34,000 individuals, including follow-ups. So there's also increased risk of feeling pain because those low oxygen levels leads to lactic acid fermentation. And that lactic acid throughout the entire body creates inflammation throughout the entire body. And the pain that we're talking about is just, simple jaw pain from all the clenching and grinding at night. Just like if you're working out at the gym, your arm's going to be sore the next day if you're doing a bunch of curls. That jaw is also in pain from clenching and grinding all night from trying to stay open for that airway. And that can also translate to headaches, both migraine as well as myofascial, which is a fancy way for saying the muscle soreness causing the headache. And then it's also strongly tied with fibromyalgia. So a lot of fibromyalgia is actually sleep apnea or upper airway resistance syndrome in disguise. So there's also a problem when we have a bad airway that head needs to posture forward to keep that airway more open. So every inch that that head is forward increases the weight of the head by 12 pounds. So imagine holding a bowling ball up, just like right next to your shoulder, versus holding a bowling ball and an outstretched arm. That outstretched arm, it's a lot harder to hold that bowling ball. So your head's about the same weight as a bowling ball. So every little bit that it's forward means that we're going to be having neck pain and instability of the upper cervical vertebra. Airway disorders are also tied to gastroesophageal reflux disorder, or GERD. When you try to breathe during the night and you're not able to breathe effectively, that negative pressure pulls the stomach acid up into the throat and into the mouth, and that's where the dots on these teeth are coming from, is the grinding of the teeth and that acid attack that happens. So by treating the suffocations at night, that can increase GERD symptoms and gastric ulcers and things like that. So the dental effects that happen with obstructive sleep apnea and upper airway resistance syndrome when you suffocate at night, the problems that we see are increased levels of calculus or tartar, that fossilized bacteria on teeth that we have to clean off at the dentist. There's also increased risk of inflamed gums, as well as wear on these front teeth from those teeth grinding forward. Your body doesn't really care about your teeth. Your body just wants that next breath. So it just grinds forward during the night to open up that airway. So there's posterior wear risks as well, and that can come from the gastroesophageal reflux, as well as pharmaceutical stuff. Because remember that overlap between depression and obstructive sleep apnea. A lot of these people are on antidepressants, and antidepressants make you grind your teeth side to side. There's also increased risk of cavities, as well as increased risk of recession, because as you clench and grind, you can clench 5 times harder when you're passed out than when you're awake. And when these teeth flex from that clenching, that squeezes the blood out of the gum and bone and makes those gums recede. And then it also puts you at a higher risk of breaking the teeth, since you're able to clench 5 times harder than when you're awake. And you're passed out, so you don't know exactly how hard you're clenching. You are just trying to get that next breath so hard. And sometimes your teeth kind of get in the way and they end up breaking. So as far as athletic recovery goes, disrupted sleep increases your cortisol levels in blood, and that cortisol increases the breakdown of your body, the catabolism that leads to breakdown of muscle instead of muscle building. And growth hormone and other anabolic hormones are restored when you restore normal sleep, so you can get back on track. So that's why it's so important for athletes and really everybody to work on your sleep. So 5 hours of sleep decreases the accuracy of serves in professional tennis players, and that's with or without caffeine. So caffeine, can make you more awake, but it doesn't make your brain make up for that lack of sleep, and it doesn't make up for that processing ability for reflexes to happen. So next, I'd like to talk about one of my patients, Ray. He came in with hypertension, and he's waking up at night. You can see that forward head posture, and you can see that open bite up front, and also how those back teeth are kind of collapsed in towards the tongue. There's not enough space for that tongue, so it gets pushed back in the throat. So we did a sleep study. We found out that he was suffocating over 20 times an hour, and he was desaturating, over 130 times a night. And his oxygen was getting down to 87%, and his heart was just zooming at 112 beats a minute. So what that means is, like, when we are doing surgery at the hospital, 90% blood oxygen level is when, like, the crash carts come. That's when we stop the surgery and focus only on getting that brain more oxygen. That's 90%. And he was getting down to 87%. Like, when kids are like, I'm going to hold my breath until I die, Dad. You're going to be real sad then. So, like, when kids do that, they're only able to get down to like 96% blood oxygen level, and then they start breathing again. So, just to put these things in perspective, our brain does not want to go below like 96% blood oxygen level at normal barometric pressures, at sea level. So, and that heart rate is also really, really high. Resting heart rate, is only around 70 beats a minute, and he was zooming at 112. So, there's a lot of sympathetic, fight or flight activation going on, and he was diagnosed with moderate sleep apnea. So here is the scan, and he's only hitting his teeth in the back. So here is the tooth movement that we were planning. We're adding about 5 millimeters or so of space, which doesn't sound like a lot, but you can see, how much things have opened up, and we took pressure off of the tongue, and we also whitened the teeth. But take a look here at the posture from the side. Now he's upright. So, that airway is getting better, and you can just see that throughout his life. His eyes look like he's more alive, and we created so much more space for that tongue. And by moving the teeth, all we did was decrease that suffocation from over 20 suffocation events per hour down to 6 to 8 suffocation events per hour, but that heart rate was still higher than what I want. So we ended up doing laser and opening up the back of his throat and also non-surgically shrinking his tongue. So by doing this procedure called night laser, we're able to decrease the snoring, and we're able to open the airway, and this is all non-surgical. So this is just heat in the back of the throat, only about 10 or 12 degrees above body temperature Fahrenheit. So we can get all of that change in there. We don't have to heal. There's no pain. All there is just heat. So after night lays, we're able to get his suffocations down to 2 suffocation events per hour and decrease that maximum heart rate. So his life is so much better. We're able to decrease his suffocations by 90% or better. His time under 90% was completely resolved. His maximum heart rate during the night went down almost 20%, and we also increased his oxygen. So there's another thing called an air retainer, which is a jaw stabilization splint. So this just prevents your jaw from falling back during the night. And with these guys, we get with over 50% reduction in suffocation events for 40% of the patients with 0 millimeters of holding that jaw forward. Which this gets even better if we hold that jaw forward. It keeps that airway more open. And there's also a decrease in jaw pain when we use a splint like this at night, even one that doesn't hold the jaw forward. So here's another one of my patients where we also did a laser facial rejuvenation protocol with our laser, where we made her sleep a lot better. Same thing for her. We also did a full mouth reconstruction, and we did some veneers up front and moved the teeth for him and made his life so much better. Same thing here with Bobby. He was suffocating almost 40 times an hour, and now he's down to 7 just by moving the teeth and taking pressure off of that tongue. And he also lost a little bit of weight. So if you are interested in this lecture, I wrote a chapter of this book with Dr. Richard Downs and Joe Zelk, who's a sleep physician that I work with. And this tells the whole story about how mouth breathing leads to deformed growth as you're growing up as a kid, and how that increased risk of airway disorders for the rest of your life can change your life. And this book tells you what to do about it. And there's a link on where to get it. And also, please keep on the lookout for more lectures out there from me. I've got another one that is more in depth as far as the journal articles out there and the research, and that one is called Health Consequences of Sleep-Related Breathing Disorders. If you're interested in that. But next time that we're going to be talking about just what to do about these problems. Thank you so much for your time, and I hope you have a fantastic sleep and a wonderful day.